Welcome to our webinar. I appreciate you being here as part of our ongoing efforts to try to enhance planning and give folks the data that they need. We're going to be talking about the Conference of Local Mental Hygiene Directors Health Portal, which is an update to our data dashboard that you've been familiar with previously. A number of you probably were on our previous webinar where we talked about that. So on behalf of the conference and CCSI, I'd like to welcome you and thank you for supporting and appreciating what we're doing here. So you've seen a previous iteration, I think, of our dashboard, and so now this is a second iteration, sort of our dashboard 2.0, which we are now calling Conference of Local Mental Hygiene Directors Health Portal. So the purpose of this health portal is to support 507 planning, systems oversight and management to give you the data that you need. We know that the good news is that you have lots of data out there now available to you. I won't call it the bad news, but the challenge is that much of that data can feel like overload because it's coming from disparate resources, disparate settings. It's often packaged in different ways. You have to have 17 different logins to 17 different sites to get access to it. So what we've tried to do here is to collect those core essential elements and to build those together, package those together in this health portal to enhance your planning opportunities. It also is going to help you in terms of the regional planning approach as we move into the RPCs, the Regional Planning Consortia, and the need to think about oversight and monitoring and collaborating, problem solving from a more regional perspective. The data that we're going to be exploring through this portal should serve you in that regard as well. Also in terms of managed care implementation and a wide range of other key priorities for us as we look into the near future of our systems changes that we're experiencing right now. As we look to the future, we're going to continue to be evolving this portal, and in the near future, we'll be looking at enhancing and increasing the amount of demographic information that's available, some locally generated data that we might be able to put into the portal for you, also some non-standardized kind of regional data that might come from local government units, et cetera. So in today's webinar, we obviously won't be able to tour you through all the elements in a high level of detail. We're going to spend the next hour focusing on a basic overview of the updates and some of the new features that have been added to the portal. So we'll sort of have that high altitude look. We want you to stay tuned for some future learning opportunities because probably what we'll be doing is going back to our short half-hour webinar model, which was quite popular. A good number of you told us that you appreciated that model, to give you details on some of the subparts of the portal. So for today, you'll get the larger overview, and then down the road, stay tuned for some specific half-hour webinars to talk to you about specific elements of the portal. So with that, I'm going to turn things back over to Ann Wilder, Executive Director of CCSI, and her team. They're going to share with you the Conference of Local Mental Hygiene Directors Health Portal updates, and hopefully we'll have a chance maybe for some questions or comments. And this will be a part of an ongoing dialogue in terms of enhancing this portal, growing it so that it has a rich array of data to help you in all of your planning needs. So thank you, and let me turn it over to Ann.
Sounds great, Matt. Thanks. What I'm going to do before we get started is just do two quick introductions. We've got two other members of the CCSI team here, Twyla DeLeon and Tabitha Gerwitz, and they're going to take a minute and walk us through a couple of the sections of the portal that have been recently updated. But as Matt suggested, I think what we're going to do today is keep things fairly high level, really focusing on sort of what data have been added since the last time we did a review of this portal, as well as a couple of new features. So I'm going to turn it over for a moment to Twyla, who is going to kind of start us off from kind of the landing or home page, and that's really where you're going to, start to access the portal. Access will be, as it's always been, there'll be a link directly on the CLMHD website, and if you go to that website, you'll be able to hop right into the portal with these updated data available.
Hello, everyone. Many of you are already familiar with the Behavioral Health Portal. When you arrive on the portal, the first page is the landing page, and this page will allow you to select the data that you are most interested in exploring. Another important feature of orientation is to direct you to the top right corner of the page, where there is background information on the data portal, instructional videos, and answers to frequently asked questions. We will revisit this portion of the page at the end of the presentation.
So if we're starting from this first page, we're going to go into the kind of first area of data, which is entitled Estimated Need. And I'll take a step back and just remind folks that the data sources identified for this version of the portal really came at the recommendation of the Data Work Group, which is a subset of the Mental Hygiene Planning Committee chaired by Deborah Goldman of Erie County. And there's really a group of community services directors, their planning staff, and representatives from state agencies that worked together to identify data sources that might be most immediately helpful in both local and regional planning. So it's really, you know, sort of from that group came the overall initial design of the portal and recommendations around data sources to populate the portal. So if we're in this bucket now, the general indicator category is estimated need, and that really looks at data sources that we think might be helpful in providing some way to quantify the potential need for service in your region or your community. I know we've got Kathy Dixon, who is research science in the Research Epidemiology and Practice Improvement Unit of New York State OASIS on the line, and we'll turn it over to her for in a minute to provide some background. But before I do, I'll just give you a general orientation to the page. If we scroll to the very bottom of this page, it'll tell us what the data source is. And in this case, we're looking at data that comes from the National Survey on Drug Use and Health. And if you wanted to know a little bit more about that survey, you could click on that link. It would bring you to a site sort of hosted by Research Triangle, who actually, you know, sort of oversees that survey. It gives you a little bit of information about the survey methodology as well as the survey tool itself. What OASIS has done, and Kathy will explain more about how this is done in a minute, is they've basically taken these survey data and applied those estimates to population data to create 2 points in time, 2011 estimates and 2012 estimates. And if we scroll up to the top of the page, we'll look at the particular indicators that we've selected to bring into the survey. In this case, we've got a view that has defaulted to Albany County, but if we go up to the top right-hand corner, you can see that you could select this for a particular region, you could select it for a particular county, or you could elect to view the data for multiple counties. So to keep it simple for this view, we'll focus, you know, just on the data for Albany County. And what it lets us know for 2011 and 2012, broken out by age group for most items, the percentage of the population who responded to particular questions on this survey that we think might be of interest. Individuals who've indicated they've got a problem with alcohol dependence or abuse. Individuals who have a problem with drug dependence or drug abuse. Folks who might be experiencing both problems. We've got estimates of individuals who indicate that they need but are not currently receiving treatment for alcoholism or drug abuse. We've got the percentage of individuals indicating that they've had at least one major depressive episode. And then for individuals 18 and older, there's survey data that describe the percentage of individuals who indicate they've had any mental illness, serious thoughts of suicide, or a serious mental illness. And what you can see with this new sort of rows of data added, you know, in the earlier version of the portal, we had data for 2011. The folks from OASIS have updated those estimates for 2012. So we're beginning to not necessarily see a trend line, but be able to look at multiple points in time. And I'll hand it over to Kathy for a minute to give us any additional background and maybe to talk a little bit more specifically about how the team at OASIS worked to derive these estimates. Kathy, you're unmuted if you want to fill in any blanks. All right. Well, you know what we can do is we can certainly circle back with Kathy. Why don't we hop out of this particular view and go into the next view, which is just another way that we might gauge for either a county or region the number of individuals who are in potential need of service. And what this view does is it really looks at the Medicaid population specifically. So, you know, admittedly, it's one component of your population, whether you're looking at it for a region or whether you're looking at it for an individual county. In this case, I think we'll keep to the individual county view, although just like all the other pages, you can go in and you can adjust your view to select multiple counties or a particular region. But what this really does is it shows the number of individuals who may be potentially in need of service based on their prior service utilization history. So what the Department of Health does is it looks at, it's basically created two categories, one called the Behavioral Health Indicator Group, the other is called the Developmental Disability Group. And what it does is it looks at the individual's past history based on fee-for-service claims or managed care encounters, looks at the services received, the provider of those services, the diagnosis or procedure associated with the service, or the drug codes related to the disorder, and has kind of created a very broad category of folks sort of in a behavioral health bucket, as well as folks in a disability group. So you see those two groups displayed for both calendar year 2012 and 2013. And what this gives you by county or by region is just some very high-level descriptive information around how many folks fall into that category. So if I were going to look at that data for Albany, we'd know that for 2013, over 36,000 individuals would be classified in that behavioral health indicator group based on their prior service utilization. We've got about 2,400 that are in this developmental disability classification. And again, it's very broad. It's really based on, you know, a prior, maybe even a single encounter with the system, but it's a definition that the Department of Health is using. So we've ported it over to this view. If you scroll down below, you'll see a little bit of descriptive information about that population broken out by age group, broken out by gender, as well as race or ethnicity. So that just gives you sort of a general frame of reference, again, for your county, for your region, or any combination of counties you choose to look at. So we're going to go from this first very broad view to a more specific view of the Medicaid data. And Twyla's going to take us through a picture of our behavioral health population. And in this case, we're going to focus more specifically on individuals who actually received behavioral health services.
I think possibly if I give people some background information, it also might help on just kind of what the NSDA is and how it's conducted and how these estimates are derived. The NSDA is the National Survey on Drug Use and Health. It's actually a federal, SAMHSA actually conducts this, and they do this basically for the entire United States and all of the states. And this is actually a household survey. Well, what they do is they send, RTI actually undertakes kind of the field work. They actually send people a letter that have been sampled saying, hi, somebody's going to stop by your house in a few weeks to ask you, you know, if you want to participate in a survey on, and they kind of couch it as important health information. So and those folks that agree, basically, when the researcher knocks on your door, you know, they pretty much just invite you, you know, they're invited into the house, and the survey is actually conducted in the home with using computer-assisted, just kind of the CADDY system. So the researcher actually doesn't ask the questions, but the somebody's able to actually take the survey on a computer screen. So that's done just to sort of, again, give people just a bit of anonymity, you know, hoping that they'll you know, answer the questions truthfully. I do want to say that New York State actually has a very high refusal rate in the survey. We're the state with the highest refusal rate in the nation, but really most of that is driven by New York City and the New York City population. The upstate population, we usually get like a fairly decent response rate from that. But really, so what the survey does is it goes through a series of questions asking about people's alcohol or drug use, and then it asks them a series of questions about consequences. And that's how we come up with these abuse and dependence measures for drugs and alcohol. And again, these are really based on the DSM-4, DSM-5 measures. Actually, since these here are actually based on the DSM-4 measures. So there is some validity to the alcohol dependence and drug dependence and abuse measures. And obviously, the need for treatment measures are just based on the fact that they didn't receive treatment in a specialty facility. And the same thing with the mental health measures. Again, those are based also kind of on the same methodology and kind of those DSM-4 questions about, the mental illness, suicide, depressive episodes. So really, what they do in New York State is they give us estimates for 15 epidemiological regions. The only counties that really have their own estimates are a few of the boroughs in New York City, while most of the upstate counties are combined with other counties. So we took those regional estimates and basically just took the population numbers from the counties and came up with the numbers that you are seeing here about how many folks are in need of or have a disorder or need of treatment but didn't receive treatment. So that's basically the process that we went through. The NSDA, how it's done is the people are out in the field continuously, but they give us estimates for the regions based on a 3-year combination. And I know you pointed to earlier that when you look at it says year 2011, that's actually 2008, 9, and 10 survey data with 2011 county population. And the 2012 number represents 2010, 11, and 12 survey data. And again, based on the 2012 county population numbers. So I hope that explains at least a little bit. So, the NSDA, the methodology is unique, but it's definitely pretty much our best source of what's really going on in the general population as far as substance abuse and mental health disorders.
Great, thanks, Kathy. And I think that was a really helpful overview. And I think what we'd like to do, sort of going forward, is schedule a time for maybe a more specific review of the data and how can it be used. But for today, as far as kind of an introduction for what's there and where it comes from, that was really helpful. So thanks for that.
Okay, thank you, Ann.
I think what we're going to do is track back to a brief update in the service use section of the portal, which really just has been updated to reflect 2013 data, which is the most recent full year's worth of data available through the Salient system. So I know that folks have probably had a chance to look at that data for 2012. I'll have Twyla bring up the 2013 view and just orient you to kind of what's there and, just a couple of the changes.
Okay, so the service view snapshot can be viewed for behavioral health recipients or developmental disability recipients. These data are aggregated by unique recipients who have had managed care encounters or fee-for-service claims through Medicaid. In this view, we've added the 2013 data. All of the data in this view has been validated by Salient, so years 2011 through 2013. They've been validated to ensure that the service categories and counts support other statewide initiatives. In order to view this data, the first step is to select the county that you're interested in viewing, or counties. So a new feature is the ability to select multiple counties. The data will then show up side by side. Now the easiest view obviously would be to have one county selected, so we'll just leave Monroe County. Once this data is filtered to the county, you have the ability to expand the OMH, OPWDD, and OASIS categories for a more detailed view. The emergency treatment release, primary care, behavioral health, outpatient, and inpatient don't have any additional drill-in. So if you click on the row for the category you're interested in, you can see an expanded view of all the underlying categories. Sorry. If you require additional information regarding the rate codes, there is a link toward the top of the page that you can click on that will link you to an Excel spreadsheet that has information about each of the drills and the other codes as well. So you get a lot of information here in terms of how these categories were aggregated. Another important step that you may be interested in is the ability to export this data to an Excel spreadsheet. To do this, you first select the row that you'd like to begin with. Hold Shift, scroll down to the last row in the range, scroll to the bottom of the page, click the Export button, select Crosstab, and then click Download in the pop-up. You'll get a little link at the bottom of the page. If you click on that, slowly open, an Excel spreadsheet will open with all of the information that you selected. You can expand the rows and columns as needed, and then you'll have a much easier format to work with the data. Make sure you save it. I'm not going to. And that basically completes that section. We'll have much more detailed presentations later on the salient data. I'll turn it back over to Anne.
And as Twyla referenced, on the landing page where we are right now, there's a couple video tutorials that'll provide you with a little bit more step-by-step instruction around things like how do I export these data to an Excel file, how do I export these data to a PDF, so I might share a report with a colleague or a group. So if we have time at the end, we'll kind of redirect you to those resources so that folks have everything they need to access the data. But in the interest of time, I'm going to keep us moving and just do a quick overview of some updated data in the housing section of the portal. And this is information that actually is available through HUD based on a point-in-time survey that all continuums of care are required to do to count the number of individuals and households that are homeless. And so the most recent data published by HUD were for the point-in-time survey in 2014. And I'll ask Twyla to quickly click on a tab that might, if you look at the very bottom of this data sheet, there's basically a link to the actual HUD site where you'll find the full report. So, I mean, the one reason to sort of point you to this is to just underscore the fact that the data portal in some cases isn't really creating new information. It's really just providing what we hope is going to be a more convenient way to access information that's already out there. There is a lot of descriptive information available at the county level, at the provider level, at the regional level, but we can't always remember exactly where it is or how to access it. So one, sort of objective of the portal is to try to bring that information into a framework that's a little bit more helpful for services planning, system oversight, and the like. So if we step back into the dashboard, I'll just orient you really quickly to what's been updated in this round. And basically, it's the additional data point for 2014. If we scroll to the very top of this sheet, it follows a very similar navigation, sort of framework as the other sheets. The only difference here is the unit of the analysis is really the continuum of care. In some cases, that might be an individual county, like we see it is for Oswego County. In other cases, it might be a combination of counties or a combination of a county and a sort of urban area. So that's the unit of the analysis. The data can be viewed for any individual continuum or for multiple continuums. So in this case, we'll stick with the Rochester view. And it just gives you an opportunity to look at, trends over time, 2012 to 2014, how many households were identified during that point in time survey, and some of the characteristics of those households, households without children, households with children, only children. If we scroll down, it's going to present really that same basic information. In this case, looking at the number of persons that actually occupy those households, again, organized by household type. And then at the very bottom, there's some additional descriptive information around particular subgroups that may be of interest, particularly when we're planning for services for the behavioral health population, as well as maybe looking for spikes or, patterns that make us feel that something within the system needs to be addressed. So in this case, the survey looked at individuals who were identified as chronically homeless, individuals who are homeless and with severe mental illness, individuals who have substance abuse issues, domestic violence, youth, and just gives you a sense for, how those counts have changed over time. There's more information about that survey methodology on the HUD site that Twyla pointed us to initially, and I think what we'll probably do is have a more focused discussion about, sort of how to use these data, as well as some of the idiosyncrasies or some of the caveats associated with the methodology that might be helpful to consider when you're using the data to support planning. So we're going to pop right back to our landing page, and I'll introduce Tabitha Gerwitz, who's going to do a walkthrough of some new data that has been brought in that help us look at some juvenile justice profiles by counties, and this is information that comes from the New York State Division of Criminal Justice Services. So Tabitha's going to give us a little bit of an overview around what data have been brought into the portal and just a few definitions so that you can have, if it's data that aren't immediately familiar to you, you've got a sense for what's been brought in.
Thanks, Anne. Good morning, everyone. So New York State's Division of Criminal Justice Services released some county juvenile justice profiles last year. The county juvenile justice profiles present county-level JJ case data broken down by processing stage for the past 5 years. It also includes disproportionate minority contact, or DMC, statistics that are reported for arrest, which is called the relative rate index, and detention, which is called the disparity rate. So right now, Twyla clicked on the very bottom link on the landing page under JJ. So this is where all the county level data is available for download. As you can see, there's both PDF and Excel links available for each county across New York State. So out of this larger data set, we have pulled out a few of the indicators and created some visualizations with the ability to look at those indicators over time, and then also in comparing counties side by side. So since we have a broad range of folks on the phone, I'll take some time today to talk through some of the data we're showing in this dashboard. But like both Matt and Ann said, we'll have another opportunity in the future to dive deeper into this data and discuss some strategies on how you can better use the data for systems oversight and planning. So first, we're going to click on the DMC link, which is the disproportionate minority contact. These data show county measures of the overrepresentation of minority youth in the juvenile justice system. Specifically, 2 ratios are used to look at both the process stages at arrest, which is called the relative rate index, and detention, which is called the disparity rate. These 2 measures are shown for the most recent 5-year period. First, we'll take a look at the arrest or relative rate index. It's also called RRI for short, which measures the extent to which minority youth are most likely to be processed than white or majority youth. So if we look at Albany County, or Monroe County, that's fine, you can see that in 2013, for every 1 white youth arrested, 4.1 black youth, or I'm sorry, 6.9 black youth were arrested. So a logical question we might want to ask would be, how does, let's say, Albany County relate to Monroe County's data? So we can go up and select Albany County alongside, and we can see a side-by-side view of the 2, just as a comparison. Similarly, at detention, the disparity rate compares the minority populations of detained Black and Hispanic juveniles ages 10 to 15 years old to the white or majority population of detained juveniles of the same age. So for example, for Albany County in 2013, for every 1 white youth detained, there were 16.5 Black youth detained and 5.4 Hispanic youth detained. So then if we pop back out to the landing page, we'll move on to the next link, which is the detention population. This data view shows overall service use and characteristics of the juvenile justice population admitted to detention, as well as how long these youth stayed in care. Data shown in this view include those classified as both juvenile delinquents, or JD, and juvenile offenders, JO, under New York State law for criminal crime-involved juveniles. This data is also displayed for the most recent 5-year period. The first two tables show number of individuals served during the reporting period, both for detention admission and detention releases. So for Albany County in 2013, there were 117 youth who were admitted and 124 youth who were released. The graph to the right shows both the average number of days from admission to release, or length of stay, and the median length of stay in detention during a given year. So for Albany County, the average length of stay is 24 days, and the median length of stay is 12 days. Down below, detention admission data is further broken down to show relative demographics, including race and ethnicity and sex. As we did on the previous page, you can compare county data side by selecting more than one county from the dropdown. And then the last stage we'll look at is placements resulting from family court petitions. This data is for the JD population only. As the other views, data is displayed for the most recent 5 years. The first data point, initial petitions disposed, represents all initial JD petitions disposed during the reporting period. A case is counted as disposed based on the date the case was favorably terminated or the JD finding disposition was ordered by the family court. The second data point, juvenile delinquent JD findings, refers to when petition charges are established during a fact-finding hearing. Under New York State law, a JD finding must be entered when the court determines a juvenile is in need of supervision, treatment, or confinement. The next data point, percent of initial petitions disposed, is the number of JD findings divided by the total number of initial petition disposed from above. The next percentage is the percent of JD findings that resulted in placement. This shows the percentage of all JD findings that ended in the most serious disposition of placement. There are 3 options when a JD finding has been entered and the juvenile has been found to be in need of treatment, supervision, or confinement. Options listed by level of intervention are conditional discharge, probation, supervision, and placement. A court order for placement generally places a juvenile under the custody of the New York State Office of Children and Family Services, or OCFS, for placement in an OCFS facility or voluntary or private agency, or a local social service commissioner for placement with a voluntary agency. If we scroll down a bit, placement data is further broken down by the type of placement, including OCFS versus local DSS custody and OCFS-run facilities versus voluntary agencies. And now I will hand it back over to Anne.
Great, thanks, Tabitha. What we're going to do is we're going to sort of just walk through one new data addition, and this is in the area of the portal that is described. It looks at the transition between inpatient and outpatient care. And what Twyla's clicked on first is just a link to the New York State OMH site, which if you haven't seen it, this includes sort of full PDF reports for 2011, 2012, and 2013 for a range of 35 performance indicators that OMH developed as to help them really look at the impact of the BHOs that were put in place a few years ago. So if we click on the report for the Western region for 2013, which I think we'll see if we scroll down a little bit, I'll just give you a quick orientation to what's in the full report, and then we'll focus on the few indicators that we pulled out to make that information a little bit more accessible. But if you go to the New York State site, you'll see a little background about the data. The data is based on Medicaid claims and encounters, although the metrics are applied to the fee-for-service population only, because that was the focus of the BHO. And they've developed a number of metrics to look at things like continuity of care, to look at engagement, readmissions, medication fill rates, So that information is all available in PDF format on the OMH site, and it's available at the statewide level, at the region level, and then within each region, you can drill in and look at provider-specific data. So that's one distinction in this particular data source is while we're displaying the data by county, the unit of analysis is really provider, the inpatient provider in this case, and it's really based on the inpatient provider's location, not necessarily the county of residence of the individual being discharged. So that's just kind of a quick look at the underlying source for these data. At the recommendation of the data work group, we pulled out a couple of indicators that folks were interested in having a little bit more flexibility in terms of looking at those indicators over time, by county, and for a particular region. So if I'll go back to the landing page, I'll quickly walk you through those. The first one looks at care continuity. And what that really is the number of discharges from a mental health inpatient setting that were seen or connected to mental health outpatient care within 7 and within 30 days of discharge. So there's a lot going on this page, so I'll take a minute and kind of give you a sense for what you see. The first one looks at that indicator on a statewide basis, by region, and then you can see that you can look at the provider-specific data by county. In order to simplify things, I'm going to go in and I'm going to select Monroe County only. And then what I think I'll do is I'll go into my age group filter and look at the information first for adults only. And just maybe give me a better way to really look at performance on this particular dimension over time, as well as by provider. So if I were going to look at my 2013 data point, and maybe I'm going to be interested in the number of individuals that had some sort of outpatient, mental health outpatient encounter within 30 days of their inpatient discharge, we can see that in this particular county, Monroe, it ranges from, we've got 56% with Rochester General, we've got about 61% with Strong, and 57% with Unity. So it gives you a sense for, how hospitals are performing on this particular dimension over time and compared to one another. I could certainly expand that view to include other counties if I wanted. I could restrict that view to only a particular provider. One feature that might be worth highlighting is if you look at the blue hyperlink in the upper right-hand corner, sometimes the data is a little bit easier to digest or perhaps to share if we do it in tabular format. So one enhancement to the way this portal works is we've given you the option to look at the data in either fashion. So what this does is it kind of reproduces that view, in this case laying the data out by table. I can go back in and simplify my view by deselecting all and selecting the county I'm interested in, Monroe. I could apply my age group filter if I really want to zero in on my adult population, for example. And if I've got this view of data now and I want to maybe quickly share it with a colleague, I can scroll down to the bottom and export. And in this case, if I want to send it over, I might want to send it as a PDF. So I'll select that option. It'll give me the opportunity to say whether I want it portrait or landscape. What I might do is hit the scaling filter and tell it that I'd like it to print only one page so it's easy for me to share. I'm going to export it. And then if I hit the download button and look to my lower left-hand corner, in a minute it should give me a pretty nice representation of the report I just crafted. So if now I think this performance data is helpful and I want to share it more broadly, I can go ahead and print it, I can share it electronically, and sort of work from there. I'll take us back to the landing page and just being cognizant of time, just look at the other two indicators that we've pulled in. So the first metric looked at continuity, really focusing on, for individuals coming out of inpatient, how quickly are they connected to some type of mental health outpatient. This metric looks a little further down the line and talks about engagement. So it looks at mental health discharges and the percentage that had 2 or more outpatient visits within 30 days. again, it gives you that same opportunity. In this case, Twyla's brought up Erie County, so we can really look at, how the Erie County providers are doing on that particular dimension. And, in this case, clearly the unit of analysis is the inpatient provider. We know that metrics such as engagement and continuity really require inpatient and outpatient providers to be working effectively together. So while it is, the measures at the inpatient level, it really is an indicator of overall system performance. Pop back out to the main page and look at one more indicator, and this one is really a medication continuity indicator. And again, focusing on, in this case, the fee-for-service population, it looks at the percentage of discharges for individuals where there was a primary diagnosis of mood disorder and where there was a prescription for either a mood stabilizer or an antidepressant filled within 30 days. So, it gives us some indication of, the extent to which individuals coming out of that most acute care setting were able to access the medication they needed following their discharge. Just like the other data we use, you can zero in on a particular county if you're interested. You can zero in on a particular age group if you're interested, as well as a particular year. But it really just lifts the data that, sort of resides in those PDF reports on the OMH website and brings them into a format that allows us to more readily maybe compare that data side by side, look at the metrics over time, and, sort of make that information sort of a little bit more interactive. So I'm going to take us back out to the landing page and just redirect you quickly to a couple of additional resources that might be helpful. The first document that you'll see is just a very brief intro to, what is the CLMHD Behavioral Health portal. And that just gives you, a quick reference around the data sources that have been pulled in so far, links to additional information about those data sources, and some high-level descriptive information. So it's just another way for you to access that information. We've also included 3 tutorials that might be helpful to you if you get stuck around some of the basic, features of the system. How do I export my data? How do I print a graph or a report? Once I've got a view of the data on my screen and I like it and I want to either save it or share it, how do I print that off easily? There's also some tips around just screen resolution. Sometimes we might bring up a view of data and it's either too big or too small, and it gives you a couple of quick tips as to how to make that information a little bit more easy to see on your screen. There's also an FAQ sheet, and this is just a work in progress. We certainly expect to add to this document over time based on questions that we get as folks start to begin to use this information. The ones that we've included so far are just some basic questions that have come up during the testing period. How do I define inpatient data when I'm looking at the Medicaid claims? How do I define primary care? So this FAQ sheet should provide you with a little bit of additional information along those definitions. And again, we'll be adding to this document over time. Probably important to know that on every page of the portal, there's also an opportunity for you to ask a question. So if you're looking at data and there's something that doesn't make sense to you, or you've got a particular question, if you scroll to the lower left corner, you should have an email, kind of a help desk email, and what that'll do is it'll direct you to a point person here who can answer your question. Sometimes it might be a technical question, sometimes it might be a question about the data. Use that email link for either one, and we'll make sure that question gets directed to the person who's in the best position to answer it, and then you get a response back. And I think that covers the main kind of updates and features, which is what we really wanted to talk about today. what's going to be happening over the next couple of months is we're going to basically be making some enhancements to the portal, not so much immediately in terms of adding new data sources, but doing making some additional updates so that the data that are there are a little easier to view, a little easier to manipulate. So making kind of some end user adjustments, as well as putting out some additional information that describes the data sources and how to, create reports. So I think those updates should be available by the end of May, early June. But the data, as we've shown them today, will be available to folks immediately, jumping off of the CLMHD website, going to that data portal link that I know many of you have already been really familiar with. As Matt suggested earlier on, we'll also follow this very general overview up with a couple more focused but briefer webinars that illustrate more specifically how some of these data sources can be used effectively to provide you with, maybe a slightly different picture of your county, your region, your sub-region if that's of interest. So be on the lookout for more news about those upcoming webinars coming shortly. And with that, I'll turn it over, we'll unmute and see if anybody has questions or if there's anything we've spent the last couple of minutes touching on.
And this is Kelly Hansen. How are you?
I'm good. How are you?
Good, good. Thank you. I want to thank Betsy and the data committee and all of you guys for all the work that's put into this. The enhancements in here are fantastic, and thank you so much. This is great work. I just had a couple of questions. On the juvenile justice information, does JJ collect information in terms of how many kids are, while they're in the system, are receiving mental health or substance abuse treatment or have a diagnosis or anything? Is that information something that's collected by DCJS?
That's a great question. I mean, we've got the links to the full JJ profile reports, but I don't think we've not seen that particular data element in that report. That's something we can do some follow-up on and see if there's more that might be available, but I'm looking at Tabitha and we're not aware, we've not seen anything yet.
Okay.
Other questions or areas that folks want to have a little bit of clarification on? I guess what I'll say is that following this webinar, we'll shoot out a quick survey, nothing burdensome, but just inviting, your feedback on the information that was reviewed today, as well as any questions you have or, an opportunity for you to note things that perhaps need to be clarified. So if there's nothing in the moment, look for that survey within the next hour or two, and it'll give you another chance to either give us some feedback or pose a question that you think needs to be addressed more specifically. And I know Matt was moving on to another meeting and wasn't going to be able to wrap us up. So I'll just say thank you so much for your participation. If you've got questions, make sure you utilize that feature of the portal, and we'll make sure that we get those questions answered as quickly as we can. And we'll also use those questions to continue to keep our FAQ document up to date, because there's a lot of information in here. And I think as folks have the opportunity to start to dig into it, I'm sure questions will arise. Kelly, Betsy, I don't know if there's anything else you want to offer before we sign everybody off.
I'll be lugging my suitcase.
Right.
I think we're good, and I just thank you again to everyone who worked on this to come up with the enhancements, and we look forward to it enhancing even further as we go down the road.
Terrific. Thanks, Kelly. Thanks, everyone.
Okay, thanks. Take care.
Thank you.